Burns are frightful and may scare a lot of people. But there are things you can do to help in cases of burn. But more importantly, there are certain things you mustn't do at all in case there's a burn. For instance, it is wrong to put oil on burns. Did you know that? I'm sure a lot of people would have been doing that before now. For this and many more, stay with us because I'll be right back. Welcome to My Health Today. My name is Dr. J, and I'm your host on your favorite health TV show. On this platform, our aim is to help you live a healthier, wealthier, and happier life. So today, we'll be looking at burns. I'm sure a lot of us would have encountered burns in one way or the other. First of all, what is burns? Burn is actually an injury to the skin and underlying tissue, usually caused by excessive heat or cold. Cold, yes, can actually also cause burns. Burns are one of the most common household injuries, especially among children. It can occur as a result of fire. Burns can also occur from fluids, such as boiling water or hot oil. Electricity, which we normally call electrocution. Friction can also cause burns. If in a road traffic accident, somebody is dragged on the road, the friction can also result to burns. Don't go anywhere, because when we come back, we'll go into details of the first aid tips you can use in cases of burns. Welcome back. Thank you for staying with us. Most people recover from burns without any serious complications. It's important to note that electricity burns and chemical burns must always be attended to in a hospital. Now, the degree of a burn is a function of the duration and the intensity of the causative agent. Now, burns are classified into 3 degrees: first degree, second degree, and third degree. So in first degree burn, we also call it partial thickness burn. A part of the thickness of the skin is affected by the burn, but it doesn't go through all the layers of the skin. Now, the features of this kind of burn is the fact that it's usually very painful, it's red, that area may or may not swell, and usually does not produce blisters. In second degree burn, the entire thickness of the skin is burnt. Classically, it presents also with a lot of pain, there is now swelling, and most times you have blisters. Now, beyond second degree burns, you have the third degree burns. The third degree burns burnt all the layers of the skin, including the underlying connective tissue, and may also extend to the bone and sometimes to the muscle. Now, this is a very severe form of burn. As a matter of fact, first degree burns can be managed at home. Second and third degree burns will have to be managed in a hospital. But there are also what we call special burns, burns of special areas. For instance, burns of the face. Whether it's first degree or any degree at all, you need to see a doctor for that. Burns of the perineum. Perineum is actually the genital area, especially with children. They pour hot water on themselves and it gets to the genital area. It's not something you can manage at home because those are sensitive areas. The thing you can do as an individual at the scene of a burn incident is first aid. And the first aid for burns is quite easy. It can easily be remembered by the acronym ECCC. That is ECCC. Now, E stands for evacuation, C stands for cool, the other C, the second C stands for cover, and then the third C stands for call. So for the first E is evacuate. It means that you must remove the person from the agent that is causing that burn. Like we said, the degree of a burn is determined by the duration and then the intensity. So if, for instance, it's on a limb and somebody sustains a burn, you be quickly remove. So once you've evacuated the patient, the next thing to do is to cool. Cool is to pour water on that area that has sustained that burn. What we actually advise is that you put it under running water. I hope you're learning something today on My Health Today. Don't go anywhere because I'll be right back to take the remaining tips. Welcome back. Thanks for staying with us on My Health Today. On today's episode, we'll be looking at burns. We've talked about the first aid for burns. We said is ECCC. So we looked at E, which is evacuate, and then this other C, which is to cool. Now we'll talk about cover and then cool. Cover means once you've been able to cool, you're actually advised to cool for 15 to 20 minutes. If it's a hand or a leg or whatever part of the body, you allow it under running water for 15 to 20 minutes. Once that is done, the next thing you have to do is to cover with clean dressing. So once you have covered it, the next thing is to place a call. What the call means is that is either you call your doctor or go to the hospital. Please practice what you've learned, because one day you may just mean the difference between life and death. And remember, until what you know becomes what you do, you actually don't know anything. I remain Dr. J, and until I come your way again on the next episode, leave us a comment, ask your questions, send us your messages, and I'll personally respond to them. Thank you for staying with us.